Hello, everyone. This video is going to cover how to level codes in the E&M section of the CPT manual, the 2023 version. That's all this video is going to address. Other topics or issues we will explore in other videos or in our discussion board, but leveling is a little bit more complicated than some of the other activities we take on with coding. So I want to just focus on that for this video and make sure the video is very manageable and doesn't go on and on and on, exploring everything we could talk about with E&M. So what is leveling? We want to make sure we understand what it is before we actually try to do it. The E&M section, again, that stands for Evaluation and Management. We kind of did an overview of it in a previous video. But the E&M section is unique in the CPT manual because each category or subcategory is offering codes for just one service. Okay. So there, if you have 4 or 5 codes in one section, they're all for the same service. So say we're talking about outpatient doctor's visit. So you go see your doctor, just regular office visit. There are going to be 4 codes that your coder or provider can select from, and those are all just for outpatient office visit. The only thing that makes them different is the complexity of the care that was provided. Okay. So maybe the very first code is going to be for very low complexity, a very basic doctor's visit. And then the final code would be for an extremely complex, in-depth visit. And so we kind of, that's why we talk about the levels. Okay. So there's different levels of complexity of service and the amount of work that your provider is going to be required to do in order to meet your needs during that service. But all of the codes in that section are for the same thing. And what makes them different is the level of care that was provided. So when we talk about leveling, there's, for the most part, for most categories in E&M, there's 2 different ways that we can decide what level was provided, what level of care was provided. Okay. Because it's not just up to, well, it was documented, the provider said this was a very high level. No, it has to be justified, right? We have to have some justification. So there's 2 different ways that we can level codes in E&M. One of them is medical decision making, and the other one is time. So medical decision making, we also call that MDM. That's the most common way that it's referred to. This is how complex the work was that the provider had to put in order to provide service. So how complicated was the care that was provided? So that's called MDM. And there are different levels. They're defined as straightforward, low, moderate, or high. And those correspond with the different codes that are in that section. And then the other way that we can determine the appropriate code to select from a certain section is time. Usually that's going to be described in minutes. So maybe it's 30 minutes will correspond with a certain code or a certain level, and 50 minutes might correspond with a different level, and so on and so forth. And we'll look at that here in a second. But basically what we need to take away from this is that there's 2 different ways to level an E&M code for most sections. And that's going to be MDM, medical decision making, or time. Okay. So I'm going to switch to the document camera so we can actually see what this means, because I'm assuming this is all gibberish if you haven't actually looked in the manual. So let me switch over to the camera. All right. So here is our manual. And we are going to go to our E&M section. And right here at the front is where we have our guidelines, you might remember. And everything that I'm talking about with leveling is covered here. It starts on page 6. And I would recommend reading through this because it's going to make more sense to you the more ways that you're able to consume this information, right? So I'm going to explain it one way, A YouTube video is going to explain it another way. The book is going to explain another way, and your text is going to explain it a different way. So getting all those different interpretations is really going to help you understand what we're actually talking about. But I would at least make sure you're reading through the guidelines a few times, particularly when you start working in this section, because it does make more sense as you go along. All right, so once we get into the E&M section, which starts on page 13, then you can see what we're talking about when we talk about different levels. So let me switch to, all right. Okay, if you look on page 17, this is going to be hospital inpatient or observation services, and you can read all about what that is here. But this is just a good example of how we have 3 different codes in this section. Okay, we have 99234 all the way up to 99236. And each one of these codes is describing the same thing. They're all describing hospital inpatient or observation care. It's all the same service. What makes them different is the MDM is the level that's described by the MDM or can be selected by time. Okay, so if we look at this, it'll tell us that medical decision making, remember that's MDM. In order to select this code, it should be straightforward or low. Okay. So that is how you would select this code, is if we knew that the MDM was straightforward or low. All right. Another way that we could select it was if we knew that the total time on the encounter, that means with the patient, was 45 minutes. It was at least 45 minutes or more. Okay. Okay. So 45 minutes. And then if we look at the next code, this is also for hospital inpatient or observation care, the MDM, medical decision making, in order for us to select this code would need to be moderate. Okay. So moderate MDM. Okay. And another way to select this code would be through time, because that's another way that we're able to level these codes. And that's going to be 70 minutes or more. So if we are trying to differentiate between the two, we would say for this first code, it would be 45. Oh, let me see if I have got another pen here. $45 to 69 minutes, okay, for us to use this code based on time, all right? For us to use this code based on time, again, I know it's a little hard to see sometimes, it would need to be 70 minutes to 84 minutes, okay? That would be need to be the length of the encounter, the time spent with the patient, okay? If you want to write that, encounter equals time with patient, go ahead and write that, because that could be confusing if the documentation says, oh, they spent 30 minutes with the patient and then 25 minutes consulting and then 15 minutes writing notes. None of that's going to matter. We have to go by time with the patient. Okay. Now, how did I know 84 minutes? That's because this next code says 85 minutes or more. Okay. So this one would be 70 to 84 minutes. Anything 85 minutes or more, we would use this code, or it would need to have a high level of MDM. All right. So that's what we're looking at here. And if when you're working through this section, if you want to go through and highlight what level each code aligns with, that is definitely an appropriate use of your time and might help make things easier for you as you're learning this section. So within E&M, remember that's evaluation and management, our very first section here. the majority of the codes you're going to level this way. This is how you're going to pick the appropriate code from each section, okay? Is that we are going to have, sorry, a whole section, and it'll give us two different ways that we can pick each code, and that will be through MDM. This one is straightforward. This one is low. So sometimes straightforward and low MDM are bundled together, and sometimes they are separated out. In this category, they're separated out. And so that would be one way to pick the correct level, and then the other way would be time, but it has to be documented. Okay. So if while you're learning this section, if you want to highlight the different levels, that would definitely be appropriate and might make life a little bit easier for you. Okay. So with this section, we would have, remember, all of these are describing the same service. Okay. These are all inpatient or observation consultation. Okay. And we can learn more about what that is here in the green guidance. But when we're talking about how do we know what differentiates these codes from each other, the lowest level is just described as straightforward or 35 minutes or more. And again, if you want to go through and figure out, hey, this is 35 to 44 minutes. This one is 45 to 59 minutes, et cetera, that's totally fine to do as well. Or if you just want to highlight it, but just make sure you understand that these are all for this, and the different level is based on how complex the care was. And that can be determined by what is called MDM or by time spent with the patient. All right. Now, there are a few sections, which we won't get into right now. There are a few sections that only allow you to use time. And so that is a possibility. Some of them we will not be using MDM, we will only use time. And so then again, just make sure you understand what the time limitations are for each code, because as you can see, they're not uniform across the different categories. Okay. So some categories straightforward will be 30 minutes, and some categories it might be 50 minutes. It really just depends on the service that's being provided. So just make sure you are aware of that and that you are able to see what the documentation is in order to select the appropriate time or the level based on time. So it has to be documented. You can't guess. Okay. All right. So that is what we're talking about when we're talking about leveling. And I'm going to flip back to our PowerPoint so we can talk about MDM, which is what the bulk of leveling is going to be. Most of the time when we are talking about leveling in E&M, we're going to be talking about MDM because a lot of documentation does not use time. And that's just the way it is. And that's the way the national exam works, is they usually don't describe levels based on time. Occasionally they do. I think it's obviously easier if you know the amount of time and you can just level based on that. But that's just not the way it works. They want to use MDM. All right. So MDM is the way that we determine how complex the encounter was. And it's not just arbitrary. It's not just something that the doctor or provider lists. They don't just say, hey, this is a high level of MDM. Nope. There's objective ways to determine the MDM. Okay. So the way that we determine the MDM is by the number and complexity of problems that are addressed. And what does that mean when we talk about number and complexity of problems? When we talk about diagnoses or injuries. Okay. So we'll look at that here in a moment. But when we're talking about number and complexity, we're going to say, hey, they have one laceration, or they have a gunshot wound, or something like that. Or we could be talking about they have a chronic condition, or they have an acute condition. Remember, chronic is something that's ongoing. Acute is just happened right now. We also might talk about minimal problems or self-limited problems. If you see the phrase self-limited, that usually means it's something that's very minor and it's going to resolve on its own or with very little treatment, like a bandage or something like that. Um, or yeah, something really minor. So that's what we talk about. It's not going to affect other body systems. It's not going to progress in any way. That's when we say self-limited. We'll look at that again here in a moment. Another part of figuring out MDM is the amount and complexity of the data that's going to be reviewed or analyzed. Data can be anything from test results to patient history to interpretation by other doctors, other guidance that we've gotten. There's all kinds of different types of data that we can look at. And so if there's very, very little data, we don't need to run a test. We don't need to see what a different specialist had said. We don't need to consult anybody. Then that's going to, again, correlate with that low level of MDM or straightforward level of MDM. And if we have a lot of data to go through, we do have to consult physicians or look at previous reports or order lots of tests. Then that is going to correlate with higher levels of MDM. The third part of picking MDM is risk of complications, morbidity, or mortality. And I think that in the past, and I've made this mistake too, and recently it's been clarified a little bit better by the AMA, but in the past we've kind of thought, okay, is this the risk of mortality for the patient with their condition? And that's not really what they're wanting you to assess. When we talk about risk of complications, morbidity, or mortality, we're talking about the risk of injury or of worsening condition or of death if we pursue further diagnostics or with treatment. So if we are going to perform a surgery, how risky is that to the patient's life? Okay, so that is what we're talking about when we're looking at risk for MDM. So we use all three of these measures in order to determine the level of MDM, and then that in turn helps us pick the code. And there are two really helpful things that we can look at in our manual, and one of them is the MDM table, which we'll look at here in a second. And then the other one is the charts in the front of the book, and we'll look at both of those. So we have an example to go through, but I want to show you the book here real quick one more time before we go through an example. Okay, and I would put tabs at both of these sections. Let's start with leveling, the leveling table, which starts on page 8 and goes on to page 9. Okay. And what this table does is it kind of walks you through each section of determining the MDM. Okay, so it'll tell each column is going to correlate with one part of what makes up MDM. So it's going to be number and complexity of problems, the data, and the risk. Okay, so that's what we will assess. And what's important to understand when we're looking at this table is 2 out of the 3 elements have to fall in this category in order for us to select that code, okay? Otherwise, we'll have to move down to a lower level of MDM. So what does that mean? So if we have, say, a number and complexity of problems, we have problems that fall into the low category, and we have data that falls into the low category, but then we have maybe risk that falls over here into the high category. We would still need to pick the low category because that's where we have two elements that fall within the same category. Okay. So it doesn't, we could have it all over this chart, but we need to make sure that we are selecting the category which covers at least 2 of those elements. Okay. So we can't have them At fall, we just have one over here in high, so then we select high. Now it's going to have to be something that's covered by one of the other lower levels of MDM. And again, if this is not making sense, that's totally okay. We're going to go through examples here. But I did want to kind of walk you through this chart a little bit first. So again, we have the category for number and complexity of problems that's addressed during the encounter. So here we have for straightforward, we have one self-limited or minor problem. So again, that's going to be a problem that's going to resolve on its own or with minimal treatment. It's not going to affect other body systems. It's not posing a serious risk to the patient. That's what minimal means. This is going to be, you cut your hand. It doesn't need stitches. It's not getting infected. There's nothing else going on. Okay, the doctor checked it out. He gave you a Band-Aid. That's going to be self-limited. It's going to resolve on its own. Okay. When we look at the low category, there's a lot of different ways that we could select this category. So if we have two or more self-limited or minor problems, so we've got a couple of little things that are going to pretty much resolve on their own, or not going to really affect any other body systems. Okay. You have a slight rash, or you burned your hand, something like that. You've got a couple little things going on. That would put us into the low category. Additionally, if we have one stable chronic illness, so you do have a chronic condition, but it's stable. It's not causing you major complications. Maybe you have a high blood pressure. It's well managed. It's being taken care of. Additionally, you could have one acute uncomplicated illness or injury. So we have something fairly serious that's happening, but it's not super complicated. It's not it is not causing you any long-term issues. It's not impacting any of the other body systems. It's fairly limited. And then there's other ways that we could select this low category, and they're all listed here. Again, one stable acute illness, or one uncomplicated acute illness or injury that requires observation level of care, so not critical care. It does require some observation. We do need to watch you overnight, something like that. That would put us into the low category. Okay. And then with moderate, we have several different ways that we can, it's progressing in severity, right? So we're going to have one or more chronic illnesses with exacerbation, progression, or side effects of treatment. So we do have chronic conditions, but they're being exacerbated. There's something that's causing additional complication, or it is getting worse. It's progressing, or we're having a treatment that is causing some additional complications, right? Or we have two or more stable chronic illnesses, or we have a new problem that has an uncertain prognosis. We don't really know what's going on. So those are the things that can fall into the moderate category. And then when we look at the high category, so this is going to be one or more chronic illness with a severe exacerbation. So something is really seriously wrong. This is going to be you have type 1 diabetes and you're in ketosis, or something else. You are losing vision. Something really complicated is happening. Something really scary is happening. Or we have one acute or chronic illness that poses a threat to your life. So it could obviously be more than that. But if we have at least one acute or chronic illness or injury that's serious enough that it's risking your life, we would put that into the high category. Okay. All right. And then the next category is going to be the amount of data, the complexity of data. And then this one can be a little tricky because remember we talked about how we need to have 2 out of the 3 elements met. There's a couple of different ways we can arrive at the correct amount of data for each section. And it's going to be, again, it's going to be 1 out of 2 categories, or 2 out of the 3 or something like that. It's going to have you pick from multiple categories within the data column, okay? So for straightforward, we pretty much have no data. We figured it out, doctor can see what's going on with you. It's not a big deal. He doesn't need to do any tests. He doesn't need to document anything. We don't need to consult anyone. We know what's going on. So it's very minimal or none at all. For limited, in order to select something from this category, you need to have one out of the two categories met at least. And it describes it here. So we're going to have unique testing that's ordered, or we're reviewing. We're going to review the results of each test or in order to pick from category one. So we'd have to have a combination of two of these at least. So we would either order new tests and review the results, or we would review prior external notes for tests and maybe order some additional testing. Okay. Or we would use an assessment that requires independent historians. So what does that mean? So we're going to have an assessment that requires some outside interpretation or independent interpretation. Okay. All right. And actually, I need to correct myself there because independent interpretation is going to be falling into the moderate or high. Okay. So if we have independent interpretation, that's going to fall into the moderate or high sections. Okay. And then the same thing goes on with moderate and high, where we need to pick a combination of it needs to be one out of the three categories. These conditions need to be met. Okay. And then the same with the high. At least two out of the three categories need to be met. All right. And again, this gets kind of complicated. It's when we're looking at how many tests are we ordering, how many assessments are we looking at, how much documentation do we need to look at, and that gets kind of complicated and tricky, right? It's much easier to look at how many problems do they have, right? But again, the more we do it, the easier it gets. And then when we talk about the risk, again, with straightforward, there's going to be pretty much no risk for treating it or doing additional testing. We're going to have pretty much no risk to the patient there. For low, there's going to be very low risk. So if we're going to do additional testing or we're going to treat it, it's pretty much not going to pose any risk to the patient. So these are going to be very low risk procedures. Maybe your EKGs, things like that. Very, very low, not going to pose any kind of risk to the patient. Moderate means there could be some potential risk to the patient. And that's still going to be fairly low. So things like prescription drugs. So we're going to prescribe some drugs. So that's moderate risk, right? Because all prescriptions are going to have some potential for misuse or complications or side effects or something like that. And then these are just examples, but I would read through those because they give you some good examples of what would fall into that. But pretty much there's possible risk to the patient. But for the most part, they are expected to not be a serious threat to their life. Okay. Now with high, it is a fairly high risk to the patient, but obviously the risk is going to outweigh or the benefit is going to outweigh that risk. And so that's why we go ahead and continue with treatment or getting diagnostic testing or whatever. And so this is going to be things like an emergency major surgery, right? Obviously that poses a huge risk to the patient, but not giving them surgery is going to result in their death, right? So other things like that. So we're going to do controlled substances, drug therapy that requires extensive monitoring, really anything like that, a major surgery, all that kind of stuff. So that poses a high risk to the patient. And so that would put us into that high category. And that's how we determine MDM. And again, I understand this does not make a lot of sense until you start practicing it. But I just want you to kind of get familiar with the chart or the table. Make sure you put a tab here so you know where to find it. and use this the first several times or even every time you're going to work on E&M for your national exam. The other thing you want to look at and also put a tab for it is on page Roman numeral 15. This is where we have our E&M tables, okay? So these are super helpful, particularly if you already know what the MDM is or the time is. This breaks down each of the sections for E&M and helps you figure out which code is the correct one to select from that category. You'll also want to note here, every time we do E&M, it's going to require, for the most part, there's a couple exceptions, but for the most part, it's going to require medically appropriate history or examination. So that's pretty much covered. You're going to need to do for basically any code you're selecting out of E&M. You're going to have to do some kind of history or examination, right? That's just part of being responsible, but that is listed here in these charts. But what's most helpful here is it will say, hey, once you figured out the MDM, is it straightforward? Is it low? Is it moderate? Is it high? You can just come to the chart and pick the correct code, okay? Additionally, if you are coding based on time, it has that option as well here. So we know if it's 15 to 29, 30 to 44, 45, everything I was going over when we were walking through each section. That also helps you here. So say we have an outpatient, remember here we have new patient and established patient. I think we went over that in the last video. So say we have an established patient who saw the provider, the counter took 25 minutes. If we come here to this chart, it's new, office, it's established, and we can look down here at minutes. Here's 20 to 29, so 25 is going to fall in there. So the code we're going to select is 99213. Okay. So that's how you'd use these charts. And these are so helpful for the national exam because you will likely get a few questions that will say, a lot of information. It's going to be a subsequent hospital inpatient service, and it's moderate medical decision making. Okay, well, I can just come here and see, okay, well, one, new or established patient, doesn't matter. I don't need to know all the same codes. All the codes are the same. And moderate, here's moderate medical decision making. Right here, 99232. Instead of me having to go through and read all the codes and find this section in the E&M, it's right here. So it can be super helpful and save you a lot of time. All right. So I would make these charts your best friend because I think they're so helpful. Okay. So I'm going to go back to our PowerPoint and we can go through an example. All right, so Mr. Ellis presented to the ER following participation in a half marathon race. Mr. Ellis is dizzy and has a severe headache. Dr. Corinth performs a medically appropriate history and examination and determines Mr. Ellis is suffering from a mild case of dehydration. No additional testing is required. And after receiving fluids, Mr. Ellis is released with instructions for follow-up care. All right. So what can we pull out of this little narrative here? So we can see these has dizziness and a headache. Both of those are symptoms of dehydration. The doctor does an appropriate examination and has determined that it's a mild case of dehydration. So it's not very severe. No testing is required. He's just given some fluids and released, I'm assuming with follow-up care instructions saying, hey, keep drinking water, drink Gatorade. If you feel any worse, go to your doctor, right? So here's what we are working with. So we know it's a medically appropriate evaluation, which we said everyone's going to have to do that every encounter. There's one problem. It's self-limited. It's not affecting other body systems. There's no risk to the patient. No data is reviewed. And there's no risk of complications with treatment or additional testing. We're just giving him some Gatorade, basically. So if we go and look at our manual here, there's a couple different ways we can find the correct code. So if we are in the E&M section itself, what we can do is we can start here at the beginning and we can look for emergency room. And we can see that that starts on page 20. I don't know if you can see this here. Emergency Department Services starts on page 20. And we can go all the way over there. All right. And with emergency department services, new or established does not matter. We don't need to know. Remember, we've made a note here, new or established, there's no requirement there. Everyone is the same in the ED. And so then we can look at each of our levels. And remember, we have one self-limited problem. We didn't need to do any follow-up testing, anything like that, but they did see a doctor. And so if we look through these codes, we'll see that 99281 is E&M of a patient that does not require the presence of a physician or other qualified professional. Now, they did see a doctor, so we would not select this code. The next one says the evaluation and management of a patient, which requires a medically appropriate history and examination and a straightforward medical decision making. Okay. And so that would likely correspond with what we were talking about. How do we know that? We can go back to our chart here. We can say, hey, remember, there was just one self-limited problem. We didn't do any data. And the treatment was we gave them some Gatorade, right? So it's pretty low, straightforward, somewhere in between here. But since we had no data, and there's absolutely no risk, and there was just one self-limited problem, we're going to go with the straightforward level. And that corresponds with 99282. What you might notice in the emergency department section is there's no option to pick for time. So we don't ever code by time with the emergency department because emergency department just works different from other departments in the hospital because you might see several different providers. It might, there might be long wait times, anything like that. It just doesn't work to code by time. So we always code by MDM. So we can put a note of that if we want. We want to say no time coding in there, or you can just see it once you go through there. All right, so my selection would be 99282. Another way to pick the correct code would be to go to the table here. And we look for emergency department services. Here we go here. Remember, new or established, it doesn't matter. And we had straightforward medical decision making. And remember, we did have to do an appropriate examination, so we could not select this one. And then it was straightforward medical decision making. So that again takes us to 99282. Okay. Oops, sorry. And then you can also see here. All right. All right, my camera's kind of falling a little bit there. Okay, then you can also see here, we do not use time, no time coding for emergency department. So we had straightforward 99282 is what we'd select. All right. So let's go back to our PowerPoint. So again, we had MDM that was straightforward. It's emergency department services. Level is straightforward, 99282. That's what we have selected, and we've seen two different ways to do it. So this was fairly simple. Obviously, it's going to get more complicated. We're going to get more complex data to look at when we get data that falls into multiple categories. But this, I just wanted to kind of show you the basics of how to level with E&M. Again, We will go through more complicated scenarios. We will look at different ways to use these charts, but I wanted to cover the basics. If this is all gibberish to you and you are not understanding it, please post in the class question board. We can walk through other examples together. We can talk through some of the situations together. I'll also be holding another live session, so we can do some of this live if we need to as well. That is all that I have for you right now, and we will tackle the rest together. Thank you.